Today, the Mental Healthcare Bill 2017 have been passed in the floor of Parliament by Health Minister JP Nadda. And not only the treatment part, but quite other aspect of mental health care have been taken in account. And this particular bill is very important high topic for summer season examination and also for the winter season examination in 2017. And also the long question and both short question can be asked in PSM examination for MBBS. So see the different aspects that have been highlighted in this bill. First, there is a very stick and carrot approach, and there are quite a few punishment have been laid out for those persons those not obeying this particular bill. And in cases of first offence, there can be 6 months imprisonment and also 10,000 rupees fine. And in the subsequent offence, the punishment can go up to punishment can be of go up to 2 years, and there can be 50,000 to 5 lakh fine. Those institutions who are providing mental health care, they have to have proper registration. Without that, for the first offence, the fine will be from 5,000 to 50,000. For the second offence, the fine goes up from 50,000 to 2 lakhs. And for any further subsequent offence, it can go up to 5 lakhs from 2 lakhs. One very interesting aspect, those persons who are going to commit suicide, or attempting suicide, they are considered as because they are under very severe stress, and they cannot be punished until proven otherwise by IPC. They cannot be charged by that. There are huge restrictions in this bill have been imposed, and sterilization of both men and women with mental illness, there is a restriction on that. There is a restriction on separation of mother and child below 3 years of age. Also, there is one important aspect. This is a humanitarian aspect. The barbaric approach of chaining a mentally ill patient cannot be done. And electroconvulsive therapy, which is a very important therapy in a psychiatric treatment, cannot be given without anesthesia. This is a very important aspect. And restriction of psychosurgeries without informed consent or approval from the concerned board. That these all 5 points are very, very important points for the summer season examination. Now these points are highlighting involvement of government ministries and officials in mental health care, and one of the most important aspect at the district level, even the decision of the psychiatrist or medical office officials are going to be overlooked by the different boards and officials of government. This is quite scary for a psychiatrist. There is one important point, nominated representative. Every adult shall have right to appoint a nominated representative who shall provide support to the person with mental illness in making treatment decisions. So treatment decision, you can opt for one person who can trust, and these are known as nominated representative. And one is the advanced directive, where a person have a futuristic ability to see that he is going to be mentally ill someday. And in those sort of situation, is the advanced directive in writing specifying the way the person wishes to be cared for and treated for a mental illness. And there will be recognition of the role of caregiver. So in a nutshell, there are one important in a nutshell that quite a few aspects of mental health care have been highlighted in this particular bill, and important points that have been given. There's a confidentiality. There's a highlights on confidentiality. Highlights giving the legal aid to the patient, making complaints about deficiencies in provision of services, and plus restriction on release of information in respect of mental illness. So confidentiality is assured out here, and this is a pretty important bill that have been passed today, and quite a few questions can come up in summer season examination from that. If you are getting benefited from this particular presentation, follow us in YouTube, Facebook, and Twitter. We're going to try to come up with many more interesting topic in the coming days ahead. Thank you.